As I notice my patient going into anaphylactic shock, I will gain access to their EpiPen. I will remove the EpiPen from the clear carrying case. I would then hold the EpiPen firmly in my hand with the orange tip pointing down. I would remove the safety clip pulling straight upwards, and I would administer the EpiPen into the middle thigh, upper thigh. I would hold this for 3 seconds, 1, 2, 3, and then I would remove the EpiPen and massage the area for 10 seconds. We would then need to activate EMS to get the patient transported to the hospital. Now we'll perform the eye examination for my patient. Here I have an ophthalmoscope, and the first thing I'm gonna do is turn it on, and I'm gonna set the beam to the large round beam. When I set it to the large round beam, I'm then gonna turn the dial to 0, and I plan to examine the right eye with my right eye and vice versa. I'm gonna have the patient look over my shoulder to the window and up so his eyes are open, and I will first check red reflex farther away from the patient. There's red reflex in that eye, and there's red reflex in that eye. I will then move closer to examine the patient's eye for clarity and masses. I don't see any deformities or any abnormalities. Now I will be performing an ear examination on my patient. So this is an otoscope. I'm going to turn it on to make sure that it works. I will be holding it with a pencil grip. I will pull the ear upward and backwards to straighten the canal, and I will watch my way through the ear. I already noticed that there is a clear pathway and no irritation or inflammation in the ear. Afterwards, I will notify any landmarks. So I'm looking at 2 o'clock in the patient's right ear for the manubrium, and then I will also notice the cone of light or light reflex in the ear. So my patient came in for his pre-participation physical exam. I will start by listening to his heart sounds. I will listen to his aortic, pulmonic, tricuspid, and mitral heart sounds. I didn't hear a murmur, but if I were to suspect a murmur, I would have him complete the same exam in a different position, whether standing up or leaning forward, but I did not hear any murmurs. Following that, I will listen to his lung sounds. Take a deep breath in. Deep breath. Deep breath. Deep breath. I'm listening for any wheezing or whistling sounds. I should hear normal breath sounds. I will continue this for listening to his lung sounds on his posterior thorax. Again, listening for any wheezing or whistling sounds or any abnormalities. I will then also percuss his posterior thorax, listening for a hollow sound that I should hear for the lungs, rather than a fluid-filled sound, which would indicate that the lungs would be filled with fluid, and it would be a medical emergency. Following that, I will complete the abdominal exam. I'll have my patient lay on his back, or lie supine, and I will first examine the abdomen for any distension, fluid, or skin changes. Following that, I will listen to the different quadrants of the abdomen, starting with the right upper quadrant, listening for bowel sounds. absence of bowel sounds would indicate an obstruction of some sort. And now we'll percuss the abdomen, starting with the right upper quadrant. Looking for dull or fluid-filled sounds. Following that, I will palpate the quadrants of the abdomen. First, I will superficially palpate all 4 quadrants, looking for any pain or abnormalities or anything sticking out. Then I will palpate deeper with 2 fingers, noticing if my patient has any pain where I'm palpating in all 4 quadrants. And that will complete my abdominal exam. So now I will be inspecting my patient's eyes. I would turn on the ophthalmoscope and check the light to make sure that it works. The dial is set to 0. I would then inspect the patient's eyes for any masses and clarity and any deformities, which I don't see any. Then I would use my right eye to inspect the patient's right eye. I would instruct him to look over my shoulder and upwards towards that window. And I would look for red reflex, which I see in that eye. And I'll switch, which I also see in that eye. And that would complete the eye exam for my patient. Now I will be performing an ear examination on my patient. So this is an otoscope. I'm going to turn it on to make sure that it works. I will be holding it with a pencil grip. I will pull the ear upward and backwards to straighten the canal, and I will watch my way through the ear. I already noticed that there is a clear pathway and no irritation or inflammation in the ear. Afterwards, I will notify any landmarks. So I'm looking at 2 o'clock in the patient's right ear for the manubrium, and then I will also notice the cone of light or light reflex in the ear. Now I will be continuing the rest of the exam. I'm going to inspect the patient's nose for any abnormalities or deformities or blockages, and then I'm going to inspect the patient's throat. So open your mouth, stick your tongue out, say ah. I'm going to look in the back of the throat at the tonsils for anything present, any white spots or any bacterial infections. Then I'm going to continue and do the cranial nerve exam. So I'm going to start with olfactory, and I have coffee grounds in this cup, and I'm going to have the patient smell the coffee grounds. Can you smell them? Yes, very strong. I smell them too. Then I'm going to have the patient test their optic nerve by reading a sign further away or doing the Snellen exam or a small pocket Snellen exam chart as well. Next, I will test the other optic nerves or the other cranial nerves for the eye, doing eye movement. So I'm going to have them follow my finger, doing upward, downward, and side-to-side motion. And then I'm going to test the other nerve by diagonal movement. Next, I will be examining the facial sensation. Can you feel that? Mm-hmm. And I will have the patient repeat after me. Hello.
Hello.
And then I will test the patient's hearing. Can you hear this?
Yeah.
Can you hear this here?
Yeah.
Okay. Then I will have the patient do tongue movement. So stick your tongue out, move it side to side. Okay. I'll also have the patient swallow. Swallow. Swallow again. All right, and then I'll also have the patient do shoulder shrugs. Shrug your shoulders, bring them up. Okay, and that will complete the cranial nerve exam. I'll conclude with the skin exam, and I will feel for any rashes, skin rashes, or abnormalities in the skin. And I think that test is correct, or negative.